News and COVID long haulers who say that they never got sick when first infected now report troubling symptoms weeks and months after.
All right, joining us now, Dr. Purvi Parikh, Clinical Assistant Professor of Infectious Diseases and Immunology at NYU Langone. And I think it's worth restating the premise of this, that people who didn't know they had it, didn't get sick, are finding out weeks and even months later that they're now not feeling well. This is yet another crazy wrinkle to the whole COVID-19 pandemic.
Right. You know, it's crazy because many of these patients actually didn't have to go to the hospital and either had mild or no symptoms at all during that first 10 days of their illness. But now 2-3 months out, they're short of breath, coughing, having fatigue, neurological problems. And it's not mild. It's interfering with their ability to work, go to school, and even function in day-to-day life.
Do we have any idea, like, are the people who are having these delayed reaction symptoms, is it worse if it's delayed like that? I mean, this was something I hadn't even heard of. I knew about the long haul symptoms, but I didn't know that it was from people who didn't know they were initially sick.
Right. You know, it goes to show that so much of this disease is from asymptomatic spread. That's why we're still cautioning, you know, be careful even if you've been vaccinated, because we're only a year into this pandemic. There's so much we don't know yet, you know, and what do these delayed symptoms mean and how long will they last? You know, I have a feeling we'll be still learning a lot about coronavirus for years to come as new mysteries kind of uncover themselves.
Yeah. Indeed, indeed. Let's ask you about this, Doctor. New lung cancer screening guidelines call for yearly scans for smokers starting at age 50, even if they kicked the habit years ago. What's up with that?
Right. You know, so lung cancer is actually the leading cause of death from cancer, but often it doesn't get as much attention, I think, because of the stigma associated with smoking. So most people with lung cancer don't survive past 5 years. Only about 20% do. So with these new guidelines of starting to screen people at age 50 and up who've had at least a 1 pack a day history for about 20 years, I think we'll catch many more of those people, especially women who get the illness early and are often missed, African Americans, because not only do they get symptoms early with less of a smoking history, this will increase their chances of survival if they can get those yearly CAT scans, and we can catch it sooner rather than later.
Right. Yeah, right. There's probably a big tendency to not want to find out, but that's absolutely the wrong tack. The earlier you get to it, the better for sure. All right, Dr. Parikh, we appreciate it. Thank you.
Thank you.